So, welcome back to another little travel nursing update. Today, I want to share my experiences with what it's like working at a SNF. For those of you who don't know, SNF stands for Skilled Nursing Facility, and the population is pretty much people there for either PT, OT, deconditioning. I've seen patients there for like hospice, recovery. So that's the population I've seen. They're kind of older, 60s to 90s, from my experience. So that's the general population of what you'll see at a SNF. So the scope of practice for an RN is pretty different than working in a hospital. So at a SNF, the RN, you could call time of death. I was very surprised to learn that, but we are the nurse on duty, and if someone should unfortunately pass, we are able to call time of death. We don't do ACLS. We only use or BLS. It's just compressions and breaths. So that's it. I remember I pretty much sent someone out because they were constipated. I remember also they sent someone out because they had a nosebleed. So the scope of practice, we definitely escalate care much faster because I don't know, maybe we just don't have the supplies or the resources. I'm thinking the resources. So we really escalate care pretty fast. Charting is a lot working at a SNF. Um, you do rely on your CNAs to get your charting info. Your CNAs shower your patients, turn your patients, and stuff like that. So definitely communicate with your CNAs when it comes to your charting and any little thing. If a patient falls, that's a lot of charting. Trust me. And then you have to do neuro change. You have to do change in conditions based on the system you're using. But been my experience so far. Charting is a lot, and there are nights when I'm in charge of 43 patients, up to 63 at one point. But it's not bad. Coming from an ICU, I'm glad I had that ICU experience because I could handle it. I absolutely could handle it. Two patients on the ICU is really like having four, five, six at times. Some people tend to forget that. So that's my experience so far working at a SNF, where scope of practice is different. In the hospital, we can call time of death. In a SNF, we can. We escalate care pretty fast. The population is more older, and you would see more physical therapy and wound care stuff like ostomy and things. Those are the things I have seen so far working at a SNF. Um, so that's my little travel nursing update.